Welcome to the Health Systems CIO Show. I'm your host, founder, and editor-in-chief, Anthony Guerra. On today's episode, I'll be speaking with Helen Oscislawski, founder and managing partner with attorneys at Oscislawski. Helen, thanks for joining me today.
It's my pleasure, Anthony. Thanks for having me.
All right, great. Looking forward to having a fun chat today. You want to start off by telling me a little bit about your organization and your role?
Sure, of course. As you mentioned, I co-own a law firm boutique based out of Princeton, New Jersey. We've been in existence almost a little over 16 years. We focus specifically on the healthcare sector and have a particular niche expertise in interoperability, data privacy, and structuring complex data sharing agreements and complex data sharing wells. Within the frameworks of federal and state laws where we're admitted to practice. So with that, over the last decade and a half, and for me, quite frankly, even preceding that, over 2 decades, I've been in the health information exchange space specifically. Of course, you and I go way back from
Yeah.
the days in Jersey and the commission, and when the first iterations of all of this were attempted, if you will, in 2007, 8, 9, and
Yep.
here we are again in 2.0 or 3.0, however you want to
Yeah.
look at it. So we, continue to focus on these areas and find that a lot of our time is spent in deciphering and working with the new challenges that are coming up, like AI and the things that we're going to talk about a little bit later today.
Sure. Very good. Yeah, I think we started around the same time. I started this company 2010,
There you
and
go.
but I was kicking around for 5 years before that. So I think we were on a similar timeline.
There we go.
Very nice. Okay, so today we're going to talk quite a bit about TEFCA, some of the things going on there. I think we're going to use the Epic Health Gorilla lawsuit as it's sort of what brought this whole thing to my attention,
Yes,
started
yes.
looking at this. So I'm just going to ask you, tell us, give people an overview of the Epic Health Gorilla lawsuit, what you think the core issues are, where it stands, because I know we're sort of waiting. I believe that the request is from Health Gorilla to sort of kick it back into arbitration, saying it shouldn't be here, shouldn't be in court. And I could have this all wrong, but that's my understanding. They're saying this is the wrong venue. Epic is saying this is the right venue. Let's go forward. So the overview of the issues as you see them that are sort of at the heart of this and where things stand with that. Then we'll go into some of the other, tangential stuff.
Sure. Yeah, so I, of course, have to preface this that I know your organizations and your listeners are often CIOs and others with healthcare systems, and we do work with a number of healthcare systems and others and stakeholders in the section. Of course, I'm simply giving you my overview. This is not legal advice. Don't go rely on this information. Make sure you talk with your in-house counsels. These are very, very dicey and very high-risk issues. So with that as a preface, I think the Epic lawsuit has really jarred the whole entire sector. It's an unprecedented lawsuit. And while we have been, or I should say, the healthcare sector has been engaging in a variety of health information exchange frameworks, both locally, regionally, and at the national level, this lawsuit has really, I think, just brought things into the forefront, some of the concerns people have been voicing for some time. So let's put it all in perspective, right? So just to create the backdrop, of course, here, there continue to be private regional things that are going on. That's not necessarily touching this. This really talks about the national framework and Epic's participation with one of the QHINs, particularly in the lawsuit named was Health Gorilla and other healthcare systems that, or other, I should say, connections that were through Health Gorilla, connectors and other participating entities through Health Gorilla. And it was Epic and a number of healthcare systems that filed the lawsuit. And they alleged that information was being pulled through these these points through the national network, which we refer to as TEFCA, or TEFCA being the common agreement and the trusted governance and contractual framework for how that information is supposed to be shared among parties. And the concept is that all parties down the entire stream, or all the entire wheels, are supposed to adhere to the same rules. That is an entire premise, or one of the premises of the TEFCA model and the national network model. But Epic is alleging that players down the stream, Health Gorilla allegedly didn't prevent certain kinds of uses and disclosures from happening in an unauthorized fashion. And a lot of the emphasis right now, although there are a number of defendants, have been focused on Guard Dog. Guard Dog was one of those participants that was connected to Health Gorilla. And the reason why Guard Dog as a defendant gets called up is because at this point they have entered into a stipulated judgment. They've essentially made certain concessions, if you will, with regard to the allegations in exchange for release from the lawsuit and other certain risks with regard to the civil kinds of potential penalties or others as a condition of that. So because of the Guard Dog stipulations, people are saying, oh, look, they had alleged treatment, and they said that they weren't actually doing treatment, and they were pulling information and releasing it to third parties, such as law firms and others. And people have really focused, and many of the stuff that's out there on the social media, the articles, even when we had an off-cuff conversation, the overriding kind of reaction and understanding of this is that this was fraudulent, or this was clearly impermissible, unauthorized. And I just wanted to take a pause. Like I told you, everybody needs to just take a breath, right? So, and I want to say a few things about that. I mean, there's like different aspects of this, but let's just start with the Guard Dog and what they said they were doing, and then what that really means. So they essentially admitted that their treatment use case really never got off the ground. They, in informal sort of postings, public PR postings, did say that they do truly believe that it was treatment what they were doing, and they did agree that they were releasing it to third parties, in this case law firms. So those are indisputed facts in the sense that Guard Dog admitted to them. So there's no disputing them, not allegations anymore, right? So so people have focused on that, and that's it. But that's not the end of the equation, because there's another piece to this that we really don't know. I don't know, you do. I don't think anybody has the complete picture of whether or not there were HIPAA authorizations or patients were signing consents to allow their information to be disclosed to law firms. I just don't know. These are facts that we don't have insight into. Certainly allegations are that there weren't authorizations, at least in all cases. But if there was a system set up where authorizations were signed and patients were actually saying, yeah, I want my medical data, my medical record to be disclosed to this law firm, and Guard Dog just happened to be the vehicle through which that was happening, is that a legal violation? Is that a legal breach? Very fact-specific questions that, obviously I can't get into, but it's to your audience, you don't forget to think about these issues, okay? It doesn't, so, people want to go straight to the fact that this is a breach, and I say, well, clearly it's pretty clear that they didn't actually abide by the contractual terms. They basically admitted that. They didn't abide by the potential, the operating procedures of how you're supposed to hold yourself out. What does treatment mean? And so at best, they were really stretching those definitions and those the applicability of the scenario to theirs to a way that's just was wrong and a breach of contract. But a breach of contract is not the same thing as an unlawful disclosure, right? So those are things that need to look at all the facts and circumstances. And the things that the piece of the puzzle we don't really have here are what percentage, or did all of the patients or individuals involved here, were they actually signing HIPAA authorizations? And I believe that Guard Dog is taking the position that they were. So that's something that I don't think is discussed about, or it's not out there as much. And I just, to your audience again, don't forget that aspect of it. The other piece I just want to say is, we've seen the entire pieces of the lawsuit play out with a stipulated judgment. We've now seen the class action lawsuits that have come up out of that. Many organizations and perhaps many of your listeners are going to be maybe processing through whether they are now obligated to issue any breach notifications. We ourselves are working with a number of healthcare systems and other stakeholders working through those very difficult questions. But the other piece of the puzzle that we haven't seen here, and I want to also just bring to the attention of the audience, is I've seen a number of people making allegations of fraud. And that's a very serious allegation, right? To have fraud, you need intent. You need intent to defraud. There is actually a criminal provision of HIPAA. It's the criminality provision that deals with the unlawful and intentional sale of protected health information, right? And the Department of Justice does have the authority to investigate clear circumstances of fraud, and they do have a number of criminal enforcement cases in egregious situations. Many of those things have turned around. If I'm going through intentionally using identity theft or medical records for identity theft, intentionally stealing medical records and selling them to ambulance chasers for PI cases. Again, everything's fact specific. But what we haven't seen, Anthony, yet, I have not heard of the DOJ investigating anybody yet. That doesn't mean that they're not. We don't know what's going on behind the scenes, and if they do, certainly, if that comes to light, then, we have a different scenario. But I see no evidence yet that intentional fraud has actually occurred. So, we should be careful in making conclusions that a scenario that may have, had varying interpretations of what is treatment, varying interpretations of what is unauthorized disclosure, equating that immediately with fraudulent activity, which is in the purview of DOJ to determine whether or not that was actually happening. So, and then the last piece is the class action lawsuits, right? So as healthcare systems, your audience, some of you may have gotten communications from Epic or others that they've been implicated or impacted by this with the guard dog scenario or others, and are working through what to do with that. Again, I can't get into the legal advice of how to evaluate those scenarios, other than to tell your audience that you need to evaluate those notifications very carefully. And maybe more importantly, you need to very carefully with your in-house legal counsel and people or, contracted counsel who really knows the space very intimately and understands it, whether or not you want to begin truly issuing breach notifications, because the impact of that is that obviously you're going to be telling a whole bunch of patients that a potential breach has happened. And I've always said for decades now, you don't want to over notify and you don't want to under notify. You want to meet your legal obligation, right? Because you can have potential repercussions for not notifying when you're obligated to do so. But you also don't want to begin notifying when you don't, especially when that really pushes a healthcare system to be the potential face of the issue, which is, kind of unfair, right, Anthony? I mean, the healthcare systems are sort of like, the poor victims in all of this in some ways, because the parties who really had the power to control this, oversee it, regulate it, create better governance structures are really the Epics and the health gorillas and those parties that were really facilitating these things. So to the extent that you can push and keep those parties the face of this, that would be the better way to go, quite frankly.
Yeah, a lot of stuff there, a lot of different ways we can take it. So, we did have a chat beforehand a little bit preliminarily, and you were explaining to me, I was under the impression, so first of all, it's interesting, and I appreciate you disabusing me of some, I'm one of these people that was like, oh my God, I can't believe it, look at this, and you're like, no, just calm down, there's gray areas, not everything. So that I think is an interesting and a good message for people. That you really need to just look a little closer. There may have been some nefarious stuff. We do have the admission, as you said, it wasn't all roses, but it may not be all rotten to the core is what we want to, I think, keep in mind, right? So, you said that you don't have to particularly be on TEFCA. you have to exchange information, I suppose, to be in compliance, but you don't have to do it through TEFCA. Do you want to explain what you meant a little bit by that?
Yeah, and I just actually want to go back and just make sure the audience understands. Just because I'm saying to calm down doesn't mean that, there isn't move, and maybe we'll get to this at the end of our conversation here, is that, because the RCE, Sequoia, and others are doing things to tighten up the governance. Governance is important. We definitely want to make this, safer, better, and all that. And we'll come back to that point. So I'm not just saying let the floodgates go. Don't worry about it. Like, you
No,
know what I mean?
I,
There is risk management that needs to
yeah,
be dealt with here, right? We
right.
don't want this situation repeating itself. But
Yeah.
okay, so we'll leave that to that. As far as TEFCA is concerned, yeah, I've heard that a lot. When the TEFCA, the actual federal regulation that created the TEFCA, in and of itself says it's voluntary. It is a voluntary framework. No organization is legally obligated currently to participate in with a QHIN or in the TEFCA framework. Okay, so and in fact, there has been a policy shift towards the federal government underscoring that, because they've gone from the TEFCA national framework to the CMS aligned networks, right? They're now leaving more room for potential networks and solutions outside of the specific QHIN TEFCA kind of model, allowing for maybe robust regionally established health information exchanges or networks or other kinds of solutions. And so they're basically saying, yeah, we recognize that the way to do this, it doesn't have to be one thing. So I think what organizations in your audience and healthcare systems are feeling is the practical pressure, because because interoperability, has been, pushed upon them. They have conditions of participation under Medicare, like the ADT notifications that are required now. They have to accomplish that. And how do you get that done, right? You need to use, and for those systems that are in Epic, they're basically defaulting to using what is the path of least friction and resistance to get that regulatory Medicare obligation done, namely the ADT. And so that has simply said, okay, well, we have to do this CMS thing, and so they're using Epic, and Epic is already, TEFCA aligned and a QHIN, and so they basically, I think in 2024, said that they're fully aligning to TEFCA, and there's no other option, other than to TEFCA. So that's where this sort of I'm obligated to participate in TEFCA. It's more like you're kind of being backdoored into it, and you don't have a choice. So practically speaking, that is true, but theoretically, a healthcare system who's not on Epic has choices. If you have a regional HIE or a state HIE, you are permitted to meet interoperability in any way that you are technologically and practically able to do so. And so it does not have to be TEFCA. And the federal government, they've put back in place the Office of National Coordinator, and they've been quite clear about this, that as long as you're, meeting those interoperability obligations and standards, then, you don't have to connect to a QHIN to do so.
So it seems like that, practically speaking, as you said, your EHR vendor is going to determine how you handle or how you satisfy interoperability requirements. They're going to be the one that decides, or they can be. It sounds like if you're on Epic, you're probably going to go through TEFCA, and
Right.
yet, isn't it ironic that TEFCA takes one of the QHINs to court, right? Because they're the ones that decided to use TEFCA to satisfy this for their customers. So it's almost like you brought us over here. You brought us over
Right.
here, and now there's a problem over here. It's messy. The whole thing is complicated and messy.
Yeah, I think the bigger question actually, and if it used to be, at least that it was my experience, that prior to Epic's total commitment to the TEFCA, it used to be that you didn't have to participated in the TEFCA, it was like there was two prongs. Like you could
Mm-hmm.
just do care everywhere, whatever it was, and
Mm-hmm.
then if you wanted to, you could opt into the TEFCA
Mm-hmm.
option. But it seems, from what I'm understanding, is that option has now been removed, and that's kind of curious. Maybe that's for your CIOs and tech discussions. I haven't had enough of discussions with the Epic tech folks of, why did they close that bifurcated option? On the one hand, I guess they felt like, they had pledged to align with TEFCA. Maybe they felt politically obligated to do so. And that was true actually for, I think, a number of other HIN vendors, including, I believe, Care Quality and Health Gorilla, that you used to be able to opt into TEFCA if you wanted to do that. Otherwise, you would just stay on their own private, immediate network, which may have been smaller, but for
Mm-hmm.
purposes of ADTs and meeting that CMS obligation, it may have been enough. So that's one thing. I don't know if there's any room for that, but you're right. I think many are feeling pressured, but maybe it's a conversation worth revisiting with your vendors and saying, hey, am I obligated to opt into this? And do you have any other solutions for me where I can meet my CMS, ADT feeds and interoperability obligations without having to opt into the TEFCA data sharing across the network, across the nation, when, practically speaking, most ADT feeds are occurring, geographically, regionally, like locally, right? So,
Right. Let's talk a little bit more about the TEFCA issues. And if you can't get into any of this stuff, just tell me. But what strikes me as the most surprising thing when I've studied this whole situation, as far as I'm able to from my position, is that this was not able to be solved in-house through TEFCA channels. You have, as we mentioned, you have sub-participants, participants, then you have the QHINs, and then you have the RCE, which is Sequoia. Um, this was all supposed to be handled in-house. In fact, that's what Health Gorilla is trying to get done. It wants to get it back in-house and have the lawsuit dismissed. So, but it wasn't able to be handled in-house for some reason. So there was about a 3-4 months period between when I believe the first letter was sent by Epic to Sequoia, to Health Gorilla, saying we got a problem, something's wrong. And then 3 more months later, they file a lawsuit. Something went wrong with the in-house policy resolution mechanisms in TEFCA. So I don't know. Do you have any thoughts about that?
again, I feel like that's a whole bunch of assumptions
It
that
probably
I
is.
am not privy to. I do
Okay.
not know what kind of conversations happen
Yeah.
between Epic and Sequoia, if any, quite
Yeah.
frankly. Certainly you would hope that there would be good faith cooperation between all parties with a common interest. Number one, in furthering a trusted framework for national exchange, as well as not making these things public. But as I mentioned to you, and now I'm just completely speculating, and I do have to be, very careful because I don't have any personal information about this. All I can say is that remember that Epic is getting sued in multiple venues and in multiple situations by other parties, including the Texas Attorney General and other sorts of parties for antitrust.
Hmm.
And I'm not even going to get into the claims, and I don't fully track the claims, to be quite frank with you. But the heart of it is that Epic is being accused of not sharing information, right? That's it. Or creating systems where they are becoming the 800-pound gorilla and are preventing fair competition, fair flow of data liquidity and whatnot. Again, I don't know if that's true or not, but that's what they're getting sued for. So it's interesting that this lawsuit this Epic lawsuit sort of puts out in the public domain the opposite of that argument, saying, at least allegedly attempting to paint the narrative or make the argument like, hey, no, you're maybe accusing us of all this anti-competitive and reason for not sharing data. But here's what we think, this is why we're not sharing data, or here are the
Mm.
dangers of sharing data, or whatever. I mean, I don't know, so some may speculate that there are business reasons or real reasons, because they are alleging things, that's for the court to fact find and prove whether they're allegations. And if they have facts that are supporting their allegations, that remains to all be seen specifically. So that all remains to be seen. But I think the point is that there could have been other motives or motivations potentially. Again, my total conjecture here.
Yeah.
Don't have any, and so we just don't know what kind of conversations occurred. And it's all, it's unfortunate that we can all say, because it certainly, I think, has created challenges, in the trust framework, and hopefully we can get past that with more robust governance, in an attempt to patch up or to improve even some of the things that we were seeing or are concerned about, as being gaps, possibly allowing for potential abuses, or, at best, misinterpretation, or, lack of consistency interpretation of how these kinds of frameworks are supposed to be used for accessing and sharing information. So,
Yeah, it's the vetting idea, right? It's that idea that
right.
Sequoia is going to vet the QHINs are going to vet the next level down, they're going to vet the next level down. And I believe that
Yeah.
the CEO of Health Gorilla is out there, they put a press release out. He's saying, now we talk about trying to position things. He's out there saying, essentially, he's saying we need more help. This doesn't, essentially he's saying this model is problematic because you can't expect, right? It's kind of ironic, but he's saying you can't expect QHINs to be able to handle the vetting that you think they're going to handle. Well, okay. Right. So he's out there almost saying the structurally on paper, this is problematic, as it was. So that whole vetting the level below, that may need some tweaking, right?
I think, one of the challenges, I work with many regional HIEs, and the difference with that model is, like, almost everybody knows each other, right? And if there's a party connecting, they know exactly who that party is. It goes through a committee approval process, and it's like, it's close to the chest, right? So the trust is really, like, it's strong, because you don't have 1, 2, 5, 10 daisy wheels out, where it's not even that the 10th daisy wheel participant out that's connecting downstream, upstream to a QHIN eventually, and pulling data. It's not even that necessarily they're doing it in a nefarious way. There is a honest and true and non-nefarious lack of understanding of these terms, right? Even with treatment, like, people, like, there are many organizations, just even take it out of the whole entire national networking TEFCA model, just when I'm looking with compliance, right? Or just like an immediate healthcare system, like, is that treatment? Is not, oh no, that's research, that's not treatment. Well, it's happening in an IRB context. Well, that's not true, right? There's so much complexity, and it's unfortunate, because simplification gets things done, but unfortunately, in these kinds of things, complexity is the devil is in the details. And you have this organization that is interpreting things, and they believe they're doing it in a good faith way, correctly, and they may not. So that consistency of interpretation, I will say that, I don't know if you saw this, Anthony, but Sequoia released updates to its treatment SOP recently. It was actually open for public comment up until last Friday. And there, we saw the entire care quality and TEFCA go through an update on the delegation of authority, right? That was the whole thing about, tightening up business associates, because the business associate and who can do things on behalf of is very, by its nature, loosey-goosey. If you take a look at those provisions and those sorts of relational allowances between a primary party and the vendor or whoever is doing something on behalf of, there's a lot of room for interpretation and misinterpretation. And so they attempted to curtail that, to strengthen that, to close some of the gaps on that, with that delegation of authority now requiring an actual delegation, some sort of documentation of delegation. Now they're doing that with treatment. So and this isn't, I don't think it's in final form, because they were opening it to public comments through next Friday. So we'll see what public comments and where it ends up. But one of the basic things is, with the treatment, they have now they've now split apart treatment into two categories, and you have to, the requesting party who's making the attestation that I'm pulling for treatment purposes now has to use it's being proposed that there are going to be two different codes that you would use. One is if you're attesting clinical treatment, where you essentially have the patient provider relationship with the individual and you're actually involved in some sort of clinical assessment or actual clinical treatment relationship with the patient. So it's a true patient-provider relationship. The other treatment where HIPAA allows for that much broader treatment, uses and disclosures, which gets into the care coordination and things related to the treatment, which is, subject to much more broader interpretation of what that constitutes. For example, is a nurse who's reviewing cases, an entire medical record to see if, for example, you have asbestos exposure, and you may, benefit from some intervention, clinical intervention, but at the same time, referring it to the law firm, there, or care coordinate for that, or do some sort of other, medication reconciliation. There's now going to be a proposed separate treatment code that if you're doing that kind of stuff and you're not actually in a patient-provider relationship with the person, you have to actually put in another type of treatment code that's going to be different. So now they're attempting to split that up, and that is like that's an example of their attempt to learn from where the weaknesses were, or where the rooms where there was room for exploitation, or not even exploitation, misinterpretation, misapplication of the defined terms, and their attempt to curtail that. So I think on a high level, Anthony, from a governance perspective, TEFCA is doing the right things. They're responding to what's going on in the healthcare sector. They're recognizing the weaknesses. As far as oversight and all that, I feel for them, and I still think that there is room during the onboarding process, and I quite frankly am seeing some of this, more detailed questions, more specificity about, who are you, what are you doing, what are you going to do with the data. So that probably wasn't being done by the QHINs or others like Care Quality at the same intensity that it's now being rolled out. That's one way to begin this. The things like what TEFCA, or I'm sorry, what Sequoia are doing in terms of splitting apart treatment, the delegation of authority, that's another way to go at this. There's that's for the committees to brainstorm, the auditing function and the enforcement function, we need to do better there. Random audits, I don't know, like, does anybody, they're right. Like, who has the resources to conduct random audits? The whole premise is to require you to make an attestation that you're doing certain things, and if you don't, that have repercussions from it, like, either getting booted off the exchange or whatever. So is that enough? I do think these lawsuits, I will say this is a final sort of observation on this point. I do think these lawsuits and the industry recognizing that there is real risk and exposure, as I mentioned earlier in our conversation, the DOJ criminal probe risk is real. I don't see any party that would really want to get entangled in continuing anything that pushes the envelope too far. And to the extent that you're not sure as a new vendor out there or whatnot, then make sure you are consulting with your in-house counsel or an attorney who can advise you of where the envelope is and making sure you're not crossing it. Because I think now it's pretty clear you do not want to cross. Maybe prior to these lawsuits and prior to all of this occurring, some were maybe pushing the envelope and willing to go past the envelope edge. And I think that there's been a chilling effect of that. I think somebody would be really reckless and, to want to push something so far where it doesn't, fall within the real constraints and true interpretation of the regulatory frameworks and whatnot. So the risks are just too high. Class action lawsuits, DOJ investigation, onward. So.
Yeah, and it makes me think, risks every which way, right? So there's risks of participating, obviously, because
Right.
now some health systems are getting sued for
Sure.
participating in what they felt they had to, and they may have had to. So there's risks of being in. There's also risks of staying out, right, and being charged with information blocking and not doing the things you're supposed to do. So, you want to get in, but you want these things to work well and to not cause you problems down the road, because you can't stay out because you'll get in trouble for that as well. It's interesting that some of the health systems that I believe signed on with Epic in the lawsuit, I believe some of them are being now sued or have been, they
Yeah.
sort of, it's almost like, you exposed yourself. I don't know, right? You tried to do the right thing, you jumped on the lawsuit, and now you're paying the repercussions of doing that. So I suppose, we mentioned some health systems receiving letters or deciding, do we have to report that there was a breach? And you mentioned that as another sort of, you have to be very careful. You don't want to report if you don't have to, and you don't want to not report if you have to. So there's a lot of sort of delicate lines here. Every which way you look, it's tough. What are your thoughts around if you were advising our readers, let's say the CIO types, uh, how should they be managing this in-house? So, for example, every health system is going to have a chief legal officer. So your head person, you're going to have compliance people, privacy people, and I don't know how this all splits up with titles, but you've got people dealing with just general compliance. You've got your legal person, your privacy person. That may all be the same person, for as far as I know, but you do have your CIO. And is it your job? What do you think is the best practice? Is it who's supposed to be watching this stuff very closely? Should it be the CIO calling up the legal person every once in a while, or informing them of what's of our discussion and saying, hey, this is all this stuff that's going on. I just want you to know about it. Or do you assume that your legal person is following this in detail? Because it's very nichey. So if you were a CIO, what's your best way to help your organization navigate this and make sure you're covering your bases?
That's a good question. Yeah, so I think starting first, if your organization has gotten some sort of correspondence from Epic that they've been impacted, obviously you're likely have already established a task group or a task to address that. So if you are one of those healthcare systems that have received something from Epic saying that your patient records have been either directly or indirectly impacted by the health guard, then you need to actually be actively doing something about that. There's questions of whether whatever you got from Epic actually constitutes a legal breach notice that is required by a business associate. And if it's not, then does your clock start ticking? Or do we take a position that that was not formal breach notice, and therefore we're not starting our clock ticking because you basically told us nothing? So, going through that, and we're working with a number of healthcare systems, and I know a number of stakeholders and organizations are working through that right now. There's been a few that have made the decision to publicly issue notifications. I'm not going to call them out to draw more attention to them, and each situation may be different. So, for example, your healthcare system may have only had 10 medical records pulled and impacted, whereas another may have had 1,000. And the outcome in those two situations and what you should or should not do, or the speed or the time frames within you having to react to that could differ, because if you had 10, then you technically have a year to notify OCR and so forth. But the point is that if you've gotten something from Epic or others saying that your medical records, then you really need to have legal, the CIO, and compliance coordinating that very carefully, consulting and figuring out and justifying why you are issuing notices or why you are not issuing notices, and making sure you're documenting that. If you're just watching this, no, I would not assume that legal. I have healthcare systems that don't even know what TEFCA is. So, if you're not on Epic, which, believe it or not, there's actually systems out there that are not on Epic. It seems that they're getting fewer and fewer, but yeah, I mean, they may not be directly impacted. They may have not gotten a notice. Just because you're on Epic doesn't mean that your medical records have been implicated by this entire issue. It depends on if you've been queried or the patients were queried and it happened to hit your organization. So yeah, if you're a CIO that has been following this, I do think that it is a good idea to get compliance and legal primed to this, and just at least outline what the issues are, what we need to be watching, see if there's any exposure on your end. And even if you're not directly impacted by the Epic situation, the Health Gorilla guard dog situation, any health information exchange has the potential for the same kinds of potential issues, embedded as part of it. So if you are participating in even a local health information exchange or a state health information exchange or a regional health information exchange, it makes sense in light of the publicity and the visibility that has been given to these issues and the class action lawsuits to understand fully how your healthcare system and is participating with these HIEs. What they're doing for you in terms of the same kind of accountability, the same kind of protections and so forth. How are you onboarding individuals? My experience again has been with the local ones. At least the ones that I've worked with are very good at that. But that's just been my small microcosm of experience. But the point is that at your systems, the CIOs, it definitely, I think, behooves you to revisit those kinds of sharing networks. Then you get into the contractual issues. Are our contracts sufficient? I do think it makes sense to revisit some of these contracts. One of the things we've learned out of this situation, so with Epic, and we sort of got this with Change Healthcare too, except they voluntarily took on the notifications that went to the patients, right? But the business associate agreement, at least the HIPAA regulatory terms, do not mandate that you specify who is going to be issuing notifications. And quite frankly, the healthcare system, even if it's a business associate's breach, okay, the business associate's obligation under HIPAA is to notify the covered entity. It then becomes the covered entity's responsibility to notify individuals, okay? And this whole scenario highlights why a healthcare system doesn't necessarily want to be the face of those notifications. You want to retain control over what notifications go out to patients or individuals, and if they go out or not, you want to retain that control, but and maybe reviewing the notifications, but it's best in these kinds of scenarios that you push back that the business associate remains the face. And it can go both ways. Some healthcare systems are like, well, they don't even know who this vendor is, and patients are going to be more distraught or more confused if they're getting a notification from somebody they don't recognize. But at the same time, there's ways to phrase that where the vendor remains the larger face of the notification, and that somehow could potentially reduce the healthcare systems being the entire face of the entire thing. It doesn't guarantee you're not going to get sued, but all these things, and just having those kinds of considerations, revisiting those kinds of considerations, and things like your HIPAA business associate agreements or your underlying contracts may be something that is worth revisiting and opening up in considering that in light of this new scenario. So yeah, I think that it's timely. It's timely, Anthony, because it's brought to the forefront some of these risk allocation issues and the risk allocation that you want to make sure that at least where you're falling, your healthcare system is falling. Like, what are we really bearing here in terms of risk, and having a good, clear understanding of what that is. And that does require, I think, the CIO with the compliance and legal, at least with regard to some kinds of conversations initially, to figure that all out to start.
Right. And I would think that as the CIO, you would want to be very closely collaborating with your legal counsel, sending them articles, updates, news articles you're
Right.
seeing, sort of briefing them on, here are three big buckets of activity in my world that are legal oriented. I assume the legal officer would find that helpful to say, hey, I'm going to send, because this stuff is changing every day, right? So I would think that relationship being very fluid and continuous would be extremely important.
I agree. Yeah, for
Yeah.
sure.
And you mentioned, a lot of gray areas. Um, does it, I mean, I think what you're saying here is that, get good legal advice, and then if it is a gray area, you have to make a decision, right? You have to analyze what's going on, get all the facts, understand the law, and a lot of times with regulation and things, there's gray area. So
Yeah,
at the very least, you want to be able to justify based on all your analysis. Here's what we decided, and then document that so that if somebody does come back to you after the fact and accuse you of this or that, you could say, well,
that's
here's
right.
what we analyzed, here's
Yeah.
what we assumed, right? Because at least you can show we did this in good faith.
Right. That's right. That's exactly right. I think you're right. Spot on with that. Right. I think it's just like denial is bad, and doing things superficially
Right.
is bad. But that's it. Good faith effort, really understanding the issues, getting the help if you want, and then documentation. Yeah, I think you're spot on.
Before I let you go, and we're almost out of time, we're expecting a big HIPAA revision to come down soon. It's going to have some stuff in there about PHI movement, tracking inventory. Uh, it's supposed to be pretty big, and I think it's fairly close to coming out. Have you been looking at that? Do you have any thoughts on, what's going on with that?
Yeah, I've seen that too. Some say that it's already in OMB. It's supposed to be released. I think some were projecting or saying that it should have been released by now. I don't know. They do like the summer and releasing rules, ruining our vacations for sure. So, but you're right. It's supposed to be a bit of an omnibus rule. Some of it dealing with the care coordination that's been, I think, idling for years now, quite frankly, and as well as, of course, the security rule overhaul, which is going to be major for CIOs. Will remains to be seen what kind of specificity and the big complaint, of course, as you very well know and your audience knows, is that the proposed standards were so prescriptive, and particularly for smaller organizations would just be cost prohibitive and impossible. So we'll see what they land. I don't have any inside, tea leaves to read on that. It's quite frankly, so I'm just waiting, like everybody else, to see what the final rule says, digest it as quickly as possible, and get going. Because a lot of times it's 60 days, unless they give us more, to implement that stuff. And it's likely going to be, particularly with the security rule, I can't imagine them giving us, that short time frame. It's going to have to be at least a year or two to onboard things. So we'll see. Everybody, I think, is waiting with bated breath.
Yeah. You're gonna make sure your printer has a lot of ink cartridges and get ready to print it
Oh,
out. 500.
no way. Yeah, I
No,
used to.
no.
I was kind of old school like that, and
Uh-huh.
I think I'm slowly, finally, I'm like, nope.
No, no.
Yeah,
Not gonna sit in the beach chair with a thousand
yeah, that's
page
right.
document on your
That's
lap.
right.
Helen, this was a pleasure. Any final thought, or you think we covered it? Anything else you want to add before I let you
Yeah,
go?
no, it's an interesting time, Anthony. Like you said, we always turn around. It's always like the 2.0, the 3.0, and we of course didn't even talk about the 800-pound gorilla in the room, or the 800, and the elephant in the room, as they say, because AI is another whole point of
Sure.
this, right? You talk about the opportunities for information to move in ways that you don't intend, or you don't have a good grasp of control over. Now you're layering automation and things like AI on top of that, and in the epic context or in the HIE context, it's happening. So it's like you feel like maybe you're starting to begin to grasp the things with what are actually occurring, and then the train has left the station on a whole different issue,
Yep.
right? So
Yep.
sometimes it feels like we're behind the eight ball. Sometimes it's tough. It's tough. I feel for organizations who are grappling with all these different changes. It is so rapid, and sometimes it does feel like you're just you're just hanging on and not being able to stay ahead.
Absolutely, 100%. I know I put out a couple stories this morning about industry organizations releasing frameworks and best practices and blueprints because they're trying to help. Everybody's trying to
Yeah.
say, give you some basic tools. Industry organizations are trying to put out basic tools, frameworks, kits just to help people have some idea how to move forward. So you're
Because
right.
those AI applications, those are going to become the connectors. They're going to become those apps that used to be, we used to think about it as like this, technology, and now it just becomes an AI app. And they're, whether it's consumer facing and it's going to look to connect through Fire applications to an HIE or to a QHIN. Like, so when we were just talking a few seconds ago about the CIO and the compliance and legal, taking the Health Gorilla, the Epic thing as an opportunity to understand how you're connected to HIEs, you got to put a footnote on that whole conversation. And how does AI affect all of this,
Sure.
right? With that conversation. So,
Yeah. And kind of next step, mind blowing is, in the old days, so to speak, uh, some human had to initiate something. Somebody did something.
right,
They may have used
right.
software to do the thing, but somebody
That's right.
did it. I mean, we're at the point where you're going to have agents out there
That's
acting
right.
autonomously to some degree independently, and so theoretically, maybe nobody did it. It
That's
happened, but
right.
nobody did it. So yeah, it's getting it's getting very sci-fi out there, Ellen.
It sure is.
All right,
So, well, it
listen.
was a pleasure.
Absolute pleasure, Helen. I hope let's not let it go this long next time. Let's catch up again down the road, maybe 6 months. Maybe we'll
Love it.
catch up. We'll get a legal briefing from Helen every 6 months. So
Anytime.
appreciate you for your time today, Helen. You have a great day. Thank you.
You too, Anthony. Thank you so much.